Breast augmentation has been the #1 cosmetic procedure for over a decade. And according to reports, almost 5% of women in the U.S. have breast implants. But now there's a group of women who want you to hear their claims that breast implants are making them sick. So we went to one of the experts in this area, one of the best, Dr. Fedric Barr from Palm Beach Plastic and Cosmetic Surgery, to talk about this because we want to get the very latest on this. So nice to see you and have you here to talk about this important topic. Let's start with a blanket question with a blanket answer. For the most part, are implants still considered to be safe, or are they raising concerns for you?
The FDA has approved them. There has been no studies that I'm aware of that definitively links breast implants with any of the issues. However, and this is the real however, I feel everybody heals differently. Everybody's a different person. So therefore, who reacts differently, we don't know.
You mentioned the issues. What are the issues women are experiencing, Dr. Barr?
Well, in our practice, we've seen some patients coming in now complaining of various things, aches and pains and headaches, something as simple as fibromyalgia, all the way to thyroid imbalance, problems with their hormones, issues even leading to possible scleroderma, lupus, autoimmune. Again, at this time, a patient comes in and tells me that they've been everywhere, they've seen doctors, they can't come to conclusion, they feel that the implants are hurting them. I've got a solution. We need to get them out.
Well, I mean, I've come to you for years and talked to you and doing stories on breast implants. And I was going to ask you, because you're one of the surgeons who does a lot of these. You're known for doing, being very good about this. Do you feel there's an issue? I mean, are you concerned when someone comes to you now and says, I want breast implants, I want augmentation?
I am addressing these issues in the same way for each person. Patient comes in that is looking to have implants. At this time, the FDA has approved them. They're new implants as of 2006. There's no studies that we know of. For that individual, I'm saying go ahead. For the person who comes in telling me that they feel their implants are making them sick, different story. I think we need to address that the way it is. There's another group of patients who have had older implants, and this also I'd like to address as well. For the moment, I'm saying we need to be intimately involved in terms of the process of evaluating the patient. Everyone should come back at least 10 years, every 10 years, to be evaluated.
And that was another question I wanted to ask you with the women who are asking to have their implants come out because they feel pain or some sort of symptom. Are they older implants? Have you noticed some kind of a trend here?
Well, the trend is over time, that's what the issues are. So these are ongoing studies. The FDA has ongoing safety studies. In my clinical practice, what I see usually is a capsular scar contracture, which is the hardness around the breast that may bring someone in for the evaluation, or something on a mammogram says the implant has ruptured. Those are implants usually of the older variety. And for those ladies, I say, if you're doing well, everything is good, don't panic, don't be scared, but do come in, be evaluated. Maybe it's time for a change out. Again, the rule of thumb is every 10 years ought to be fully evaluated, make sure everything is good, and then do the consideration of what to do from there.
Yes or no, the women having these out feel relief?
We've had some good results, but the true follow-up long-term is not in yet.
Still not in.
Yes.
Dr. Barr, thank you for your time and all the info. To learn more about the dangers of breast implants and more about Dr. Barr, head to our website, WPTV5 and look for the As Seen On section, and we'll have the link right there for you. Let's send things over to Glenn.
All right, thanks, Roxanne.